earth is the Lord's, and the fullness thereof, the world, and they that dwell therein. Which means all of us have that access to that place with Christ. And so tonight it is a momentous moment for me. I am so happy. Put your hands together, ladies and gentlemen, for the team. We will be looking at some of the very express topics such of mental illnesses, such as mood, anxiety disorders, personality disorders. We will be kind of circling around the psychotic disorder, trauma disorder, eating disorder, and of course, substance abuse that makes up a wide range of the questions that might be asked this afternoon. And so, ladies and gentlemen, without any further ado, I'm going to ask the educator to open for us this evening on this amazing topic. Thank you, ma'am. Go ahead.
Thank you so much, and thanks for the opportunity to educate, especially our church community, and also the Afro-Caribbean and Black community on mental health and mental illness. We definitely cannot have a conversation on mental health and well-being without differentiating what mental health entails and also what is mental illness. So we all have mental health. Mental health is a state of well-being, and it's based on our ability to function, our ability to cope, and also our ability to be productive and to cope with life problems. So for example, we may have good mental health, but there are certain things that may trigger our mental health. For example, the death of a family, worrying about things, and so forth. So however, when it comes to mental health, it's different. Although it is used interchangeably with mental illness, there are two different concepts. For example, when we think about mental illness, we're thinking about a diagnosable mental health condition. And that could be things like depression is a form of mood disorder, anxiety, substance abuse, and so forth. But we will also be looking at, as a panel, talking about the stigma of mental illness and ways of coping. So I'll pass it over to Sister Rodell so that she can talk a little bit about the stigma. But before I move on, I just want to let you know that when it comes to mental health, we all have mental health. It's a state of well-being. We get up every morning with function. Our mental health is good. But we could experience some level of loss, and that affects our mental health, our level of function, especially the way we think, the way we behave, and the way we act. And again, we cannot talk about mental health without talking about the stigma that creates barriers to accessing and the way we perceive a person with mental health problems.
Thank you very much. Come on, put your hands together for her. So if you listen carefully, there is a huge distinction between mental health and mental illness. Thank you very much.
Thank you so much for giving us the opportunity, as Sister Fiona said, to educate our community and, of course, the African community at large. Now, as a mental health first aider, I am so excited to be a part of this conversation. I have taken a stance to say no more discrimination and no more ignorance. Let us have these conversations so that we can unpack the facts surrounding mental health and diminish the stereotypes and the stigmas that are surrounding this dialogue. 1 in 5 Canadians experience mental illness in any given year. We all know someone. So I'm encouraging you, let's unpack it. Let's talk about it. Let's have these conversations so that we can educate ourselves and so that we can also be support to those that are experiencing mental health.
Thank you very much, ma'am. Put your hands together for her.
Thank you very much. As regard to mental health and mental illness, in Africa, for instance, coming from Africa, as a registered nurse, I experienced for my own self a family that's undergoing mental illness. In Africa, it's so stigmatized that nobody wants to associate with such a family. Even to marry from that family is like a taboo. So it is important for us to discuss this topic so that everybody will become aware that nobody is below being affected by mental health. Like she said earlier, that everybody is susceptible to mental health. So we need to understand this fact this evening.
Thank you very much, ma'am. Put your hands together for her.
Good evening, and again, thank you for the opportunity in discussing and bringing awareness to mental illness. As my previous colleagues have already discussed, the importance of this, bringing this awareness forward, that everyone gets to understand that there is a significant difference when it concerns health issues or a person's perception of mental illness. So when we look at the crisis intervention for someone undergoing a mental illness, it is important that one realizes that a crisis situation is just a brief, focused, sometimes time-limited treatment phase in dealing with the situation, and that individual would perhaps need more prolonged intervention. So it's important for the individual to know this, families and those that are supporting this individual, that they are going to undergo a somewhat prolonged supportive session with this individual. So I hope that we can all put a closure to the stigma, as we've said consistently, and that we all work together in helping individuals with mental illness.
Thank you very much. Put your hands together. Now, as we go along, we will get, for the public and the audience on the outside will get the names as they speak. But, ladies and gentlemen, the only man on the panel this evening, Brother DJ, put your hands together for the gentleman. And sir, we want to have your perception of mental health, mental illness, and how you've seen it in your line of work.
Thank you for having me here. I'm not as versed as our other panelists here. They're all well versed in mental health, being in the field. I'm more on the business side, but I believe, like everyone here has touched on, that mental health impacts every aspect of society. Doesn't matter if you're a doctor, if you're a nurse, or if you're a person that drives a bus. We all have certain things we have to deal with because we all have minds, right? And every mind can be impacted in a way. So even though I'm not in the field where they're experts in, I've experienced mental health issues. So I'm actually here to learn from them and also maybe get some input as to how to improve myself going forward. So
Very interesting, very interesting. We're all here to learn. And ladies and gentlemen, might I tell you, we are ranging from RNs, we are ranging from business owners, business persons, into educators, into doctors. And for us this evening, it's an awesome opportunity, because I want to make sure this evening that I represent the layman, the man who has no knowledge that what he or she is going through might just be a simple form of some of the disorders, and the care might not necessarily be to be in a hospital setting, but rather to speak to an individual such as any one of these wonderful personnel at the panel. Now, the question I want to begin with this evening, I stopped looking after myself. I neglect my appearance, stop participating in activities, in hobbies. I just fail to come to anything that is family-oriented, or my socialness is just diminishing. I'm becoming increasingly reclusive. This might be a sign of a problem. Now, I want to touch the educator this evening. What would you recommend for me?
So to begin, I I will say, like, this session is basically to raise information and to diagnose, to say that based on what Pastor Williams say, that person will be struggling with what we call a mood disorder, and that could be a symptom of depression. But in order for a person to be clinically diagnosed with depression, they have to experience the symptoms for a consecutive 2 weeks, and especially during the teenage years, because mental health begins as early as the teenage years. And sometimes those symptoms are misinterpreted as normal teenage behavior. And that could be one of the reasons that delay early intervention. So as parents, it's so important that you pay attention to your children, the way they present, their behavior. So if your children have lost interest, or even adults, lost interest in the things that they love, isolating themselves, their behavior, you could pay attention to the behavior, but also their cognition, meaning that the things that they are saying. If they're saying, I don't like myself, I feel helpless, I feel hopeless, how are you going to help that young person? Because most of the time, some of the common symptoms when it comes to depression is that feeling of numbness, feeling stuck, feeling like life is not worth living. And they would express that verbally. So you have to pay keen attention. And the most important thing, speaking from a religious background also, remember the Bible has said us that God, the Bible spirituality, give people a sense of hope. Give them a sense of purpose. So when somebody is going to depression and they feel helpless and hopeless, we could use our spiritual awareness to help motivate them and reinforce their identity in Christ. And there are other strategies that are available. For example, with depression, it's a mood disorder. So you have to address the cognition, the negative thoughts, because the thoughts, the behavior, and the feelings, they are all interconnected. So being able to connect that person with the right resources to help them. And again, depression, it could be a result of situational factors. Like, as I said, the death of a family, bullying, all of these, transition in life. It can even be genetic. And sometimes, okay, a parent may be struggling with mental illness. Doesn't mean to say, for a depression, doesn't mean to say that the young person automatically will be diagnosed with the mental illness. It just means that the person will be at a higher risk of having that. And also, mental illness is like a biological factor where they say it could be chemical imbalances in the brain. But at the end of the day, what is important for anybody when it comes to mental illness is recognizing the early signs and the symptoms. And that will give you an indication that something is wrong and intervention is needed. And I know because of the stigma within the Afro-Caribbean community, I know I'm speaking a lot, but that's,
No,
I hope
that's
I'm
why
not
we're
saying too
here.
much. Okay, within the Afro-Caribbean community, just the stigma of mental illness prevents people from actually seeking help. Because the stigma when it comes to calling somebody like cuckoo, psycho, schizo, these are very debilitating words, like very disparaging words. And it can be as harmful as the illness itself. But most importantly, we have to remember, we got to separate the illness from the person. This is still a person that deserves to be treated with respect and dignity. So it doesn't matter what the person presents with, the way that we approach that person can determine whether or not that person is going to get the help that they need.
Wonderful. I'm so happy, sorry, that you've taken this from a biblical perspective. And I tell you why. In the book of Proverbs 11 and verse 14, the word of God says, where no counsel is, the people will fail. But in the midst or multitude of good counsel, there is safety. And another version says, purposes are born. So I'm glad that you've taken it from that aspect. Because in the Afro community, we have done a very ignorant job. And when one hears of a mental illness, automatically that person is written off. So we want to make sure that we help even that little 1% to understand that there's still hope for someone who might be perceived in this path. Now, I want to ask this evening, Sister Bernard, I understand, I'm a layman on the street, when I walk into the hospital and you are the charge nurse that gets the chance to take me in, is there a time when you look at my general appearance and the way I present myself to see whether or not there's something going on with my mental stability, or in this case, instability?
Most definitely. We are trained as registered nurses, and part of our assessment is doing exactly what you just mentioned. The very appearance of the individual, their perception of what is going on with them is vital during that initial stage of assessment. And before we can come to any clinical diagnosis, we first have to look in all the variables and to see exactly what is going on with the individual.
Thank you very much. Sister DG, if I walk in the hospital and my family brought me in, and you're the person at the desk, and when you've asked them, why are you here? The answer would have been, well, my son shuts himself in the room for 2 days, has not spoken to anyone, refused to have a bath, bed is not spread, and all of this. Give me an understanding of what might be your initial thought.
Thank you. My first thought will be to assess your mental state, asking you certain questions like cognitive questions to know your thought process, to know if you're confused or depressed. Then, taken further from your answers, will make me know that you're going through some mental dysformation or mental disabilities. So that I will make notes and make the doctor, because we work as a team, then a psychiatrist will be involved in your care because I already know that this is the mental health issues that you're coming with.
Thank you very much. I'm glad you touched care. So I'm going to ask Mrs. Dwyer this evening. So I've moved from not wanting to appear decent, and I've moved to being unmotivated. I've moved to being emotionless. I've moved to being ignoring my surroundings. What are some of the care measures that you would seek to advise?
Thank you. Some of the things that come to mind is, well, the first thing is educating the family or friends or support people of that individual. The knowledge and education is important because only when they have that will they be able to support the individual or care for the individual going through that. I myself would also recommend the various help aids that are out there to the individual as well. So I know that CAMH has tons of resources available. There is a text line, there is online chat. There are so many resources available to people that are experiencing these things and that they need the appropriate care. But one of the things that comes to mind is that individual has to want it. And I always say that, taking care of your physical is the same as taking care of your mind, because our bodies are fragile and so is our mind. And so you have to want it. So the support people can't want it more than the individual that's experiencing this trauma.
It is interesting that you said that, because remember, I'm emotionless. And I'm totally disconnected from the considered norm. So at this point, I'm glad you said it the way you did, because at this point, ladies and gentlemen, we are looking at the family, the care group that is being put in place, and the family is going to be the first group.
Absolutely.
A lot of times, the family is usually the first to detect when something is offline. Mm-hmm. And so I have become motionless. I have become withdrawn. I have become unmotivated. I am not caring one bit about what you're going to prescribe. But those who are around me, they have to deal with me night and day. There might be that 1% of chance that there comes a time when I slip out from where I am to a place just to listen and to reflect and to see where I am as to who I was. And that might just be the key turning the engine for mobility. So thank you very much for looking at it that way. I want to turn my, my dial a little bit to our educator. And I've so much seen what I would term as mild disorders of anxiety in our society, in my people that I serve. Can you just open for me what exactly is an anxiety disorder, and how would you give a general understanding to people looking and listening as to when this thing is happening?
So when we talk about anxiety disorder, is a state of like constant worry. A person is always worry about so many different things. And there are different types of anxiety disorders. Some people may know about panic disorder, social anxiety. And social anxiety shows up in a lot of young people. That fear of embarrassment, feeling like they cannot go to a social situation or go to a friend's party because somebody's going to say something about them. They're going to embarrass themselves. They will say the wrong thing. And then there are generalized anxiety. That is anxiety that's a person worried about so many different things. And an example I could give you, remember working with a young lady, and she was very anxious, and she came to me because she was concerned about her school, her grades, and she was doing exceptionally well. And being worried about her grades, she was worried about, if I don't get the right grades, I would not go to university. If I don't get to go to university, I wouldn't marry. If I'm not married, I wouldn't have kids. I wouldn't have a home. I wouldn't have a family. So you see, like, the anxiety, the worry just keep getting worse and worse and worse. And it happens over time. So I wouldn't go deep into the different categories of anxiety, but what I can say, anxiety, it's a real issue. There are healthy anxiety and there are unhealthy anxiety. So when we talk about healthy anxiety, that anxiety that we need to push us, to motivate us, to get something done. Okay, I have a deadline coming up, I have to get it done, I have to get it done. And you push yourself to work. And then there is the unhealthy anxiety that disrupt your daily functioning. For example, somebody who have obsessive compulsive disorder, they always have a routine, like they always checking something, always washing their hands, cannot leave their home, or they leave their home and then they drove a few distance and then they think about, oh, I haven't turned off the oven, and they come back, check, continue to drive, and then they come back again. So it's that constant state of worrying and going back and forth. But at the end of the day, anxiety, it's a real issue. It is one of the most common mental health problems affecting a lot of people. And there are different ways of addressing anxiety. And one of the things that we use in clinical counseling is called cognitive behavioral therapy. So it really addresses a person's thought. Because if you have an anxious thought, that thought will drive you to engage in anxious behavior. And another example that I will give you, for example, if you're walking down the street and you see a nice little puppy, you'll be, probably if you like dog, you will walk towards the direction of the dog. You're not anxious about it. But if you see a pit bull, that again will give you anxiety. You will walk away. So again, the thought that you have will drive the action that you take. And that's what anxiety does. So how you will look at, recognize anxiety in a young person: fear, trembling, heart racing, that constant worrying. And one of the things that, as I heard, like I was at this seminar and I heard this person said that worrying is like a rocking chair. It gives you something to do, but it actually takes you nowhere. And that's what unhealthy anxiety does.
Thank you very much. It gives you something to do, but it actually takes you nowhere. That brings me to one of the points that I want to throw at my medicals here. Now, let's say I have a way to make sure that the sheet on my bed is from one corner to the other, the same height from the ground. Do you think I'm having a disorder?
Well, if it is continuously being so, it becomes a disorder, because you shouldn't worry about your shit being certain way continuously. It becomes compulsive.
But isn't it not a real fact, though, that as much as that is deemed a compulsive disorder by the powers there be for me, isn't it not a fact that it is also a disorder for you wanting me not to accept that?
Well, this is where it becomes controversial to you and to me, because in my educational knowledge, it is compulsive.
So then it really boils down to how intense or adverse that situation might be, and whether or not it makes a difference in one's life. That's what it really boils down to, I would imagine. And by the way, that's a really decent answer. Now, I want to shift a little bit over to the gentleman at the panel. Sir, based upon what you've heard, I want to ask you a question. Let's say you have a customer walk in your business, and you notice your customer keeps going over the same place time after time, bearing no fruit to what he or she is doing. Based upon what you've heard this evening, what would have been your first thought?
I actually experienced that quite a bit. When it comes to buying property, because it's such a big part of people's lives, it's oftentimes the biggest investment anybody will make in their lifetime. There's a tendency for people to overthink things. So I do oftentimes run into people going back and forth on decisions. But there's a saying in our industry that says there is paralysis that comes with overanalysis. So if you sit around thinking about a decision rather than making a decision and actually taking the action, you're going nowhere. So oftentimes I give them space. I let them think things through, because it's good to think things through. But when it's to the point where you're missing out on opportunities, nothing is getting done, then at that point you're just doing yourself harm. And that's when I try to step in and give them a bit of a nudge, or let them see why one decision may be better than another one.
So I'm hearing you're saying that what is happening here definitely gives you a brighter light, so to speak, shining on the topic and how to deal with such persons. Thank you very much. It's very interesting, because our educator at the panel this evening did touch on, in most times, this is a sense of fear. And it's interesting. And I say this to say that our Creator knows who we are and knows when He created us exactly what was necessary for us to be here and to fulfill our lives here. And so when I look at an argument coming out of the book of 2 Timothy 1 verse 7, it really empowers us, if you're a child of God, to realize that God did not give you a spirit of fear. And so this is where I would begin to lay my foundation as a pastor. But the spirit of a sound mind and boldness and of love. And this, of course, would help the persons to understand better where you are. I would solely look up to the people who have the responsibility to cater for people with these disorders. But my thing is, I really want to know when it is a real issue and when it is not. Because for the general public who hasn't got the knowledge that we have, I guarantee you, particularly in our Afro community, I guarantee you, people are labeled crazy for simple things that a good counselor could take care of. People are labeled crazy for things that the family could easily help them get out of. And so it becomes an issue that we really need to look at. There's a question that is being posed, ladies and gentlemen. There's an individual who says, I believe it only amounts to a disorder if it controls your regular functioning to the point where other things in your life falls apart. And I think that's a very good argument to accept. You know, never give those people too much choices. But the truth is, though, life is a path of a multiplicity of choice. We came here with these choices. We came here with the rights to choose who we want to marry, where we want to live, the car we want to drive, the clothes we want to wear. That is an inherent right. We came here with that. And so you're not giving someone that. It is there. So this is where psychologists and psychiatrists draws their understanding from when one has tapered off in the deep end. You see them when they have moved from what is considered the norm. And I want to bear with you tonight that it is quite a topic and it is quite a response on the people who's got the responsibility to cater to these people. I want to move now to the next topic, if you will, of mood disorder. And everybody here has seen that so often. But I want to, again, ask our educator to kind of give us an overview of really what is a mood disorder? When do you come to the conclusion that I'm having a problem with my emotions?
Well, just as an overview, when we think about mood disorder, we think about when a person's mood is affected, like the way they think, the way they act, and the way they behave. For example, as I said before, the most common type of mood disorder is depression, and there's also bipolar disorder, which is also a type of mood disorder. So with depression, what we have to look for and what we see as one of the common signs and symptoms of depression is the whole idea of suicide, having suicidal thoughts, wanting to kill themselves. But at the end of the day, when it comes to depression, it affects people differently. And most of the time, the first symptoms that you will notice the person would experience is like physical. They will feel fatigue, feel, as said before, a loss of interest, isolation, negative thoughts and behavior. And as when it comes to treating depression, we have to understand what is causing depression. As I said before, it could be genetic factors, it could be situational factors, it could be biological, for example, chemical imbalance in the brain that needs to be addressed with medication, if you're looking at the biomedical model. But at the end of the day, people who are struggling with depression, it is very stigmatizing to say a person is depressed. As I said before, we have to separate the person from the illness. And a person who is struggling with depression, they need support. And sometimes within the Afro-Caribbean community, if mental health and mental illness is not something that is talked about, then parents or people in general within that community can mistaken a mental health issue for a behavioral issue and may say like that person is just lazy, they need to get up, and you may use force or whatever to try to get the person to snap out of what they're going through. But at the end of the day, it's a real issue that the person is going through. And once you understand it, and I'm glad we have in this forum to really raise awareness and literacy within the community so parents are aware. So you don't blame their character. You don't say it's a character defect. You are lazy, you are slow, you have bad attitude. This is not gonna make the situation better. But in other words, you have to be able to come from a place of compassion and also listen to what the young person has to say. Because so many times they are talked to, rather than given the opportunity to express what they're going through. And that young person or anybody who's going through depression, they are in a position to really tell you what's going on. So just listening and giving them that outlet where they feel safe to share their story. And also make mental health conversation part of your household. Talk about it openly so young people are not ashamed. So so what we're gonna do, we're gonna end that generational stigma as it relates to mental health.
You know, it's interesting because in most cases, folk are talked down rather than talked to. But let me shift a little bit to the people who have to deal with it on a daily basis. How do you differentiate the genetic chemical imbalance arena from other? Because in this particular case, you're losing the sense of self. You're losing gravity on your interpersonal relationships. It becomes dysfunctional. And it is a very thin line, to be honest with you. I've had a lot of this to deal with. When you see someone in one day changes into 5 different personalities. And what I found out over time, sometimes this is used as a deflective mechanism. I have noticed that in recent years. People want to go somewhere, want to do something, and they put up intentionally that barrier that I'm angry. So you leave them alone so they get to do what they want to do. I've seen a lot of that. The question to my nurses is, how do you actually get to the point where you can say, no, this is not an imbalance. This is not an hereditary factor that is so entrenched that causes this behavior, but rather a mechanism. How help me here and help the public here. How do you determine that?
Okay.
First of all,
Like to. Thank you for the opportunity. As we're on the topic of mood disorder, there are various behavioral reactions, which you just identified some of those. The person may have a startled reaction the minute you approach them. They may be a bit defensive. The person may be restless. You see them pacing all over the place. You know that something is actually going on with that person, that individual. Later on, the person may have, for late onset behavioral issues like avoidances of events where they need constant reminders. It's part of the assessment process, as well as to know when the person maybe is experiencing some level of self-esteem issues. And you mentioned earlier about the stigmatization. How do we as the professional nurses deal with such an individual? First, we have to remove the barriers. In our profession, we can't, it's not part of nursing to put a stigma on someone with a mental illness. We have to treat that individual, and as well as to instill hope in that individual that there can be something good at the end for them to look forward to, and giving them the resources that they need so that they can return to pre-crisis functioning. So that's part of their defensive coping mechanism in saying, okay, I'm angry, stay away from me. But we have to recognize that that person needs our help. We can't ignore that person.
But
altogether.
the question becomes, somebody using this tool to deflect somebody coming to them, at what point do you understand, hold on? Because what I'm hearing out of you, which is quite truthful, is for someone who has a chemical imbalance or an hereditary situation, that would not be somebody who later on would be ready to go to, let's say, a function. You get my point? This is going to be something constant and needs the intervention of medicine.
Right, right.
And so it gets to the point where that, for the individuals, the personals who have to deal with the professionals, I would imagine that this is what you would take into consideration over time. And this is why you have people in waiting periods to see how they react over a period of time, whether or not this behavior pattern is consistent or not.
Exactly. And there's a step in the process where that is concerned. If we notice that an individual, a patient, is getting out of hand, then of course we have the crisis intervention team, security, who would step forward, as well as we would know that that person needs an immediate some drugs to keep them calm. Because that person will be irrational, you won't be able to deal with that individual. Nothing you say will be of any effect to that person. So it has to be intercepted by some form of medicine, calming drugs, in that case to get that individual to calm down, and after which you can proceed with the treatment.
Okay.
If I may contribute to that. This individual, because you mentioned chemical imbalance, so once they are in the hospital, we have to draw blood to ascertain that they don't have potassium or sodium being low, which can affect individuals' behavior. Or the doctor have to order a CT scan to make sure there is no brain malformation. So with that said, after those analysis and assessment, you now be able to determine the kind of mental illness this individual is having. Could it be if it's chemical imbalance, what medication that is needed, or if they need surgery, because there could be a brain tumor, there could be something going on, aneurysm going on, or something of sort. So you don't just see a person with their behavior and just rule out. You have to rule out so many things before you conclude on the type of treatment given to the individual.
Thank you very much. To our mental health aid here, is it possible to be mentally unwell but still functional?
Yes. Absolutely, absolutely. Again, mental illness and mental health, as our panelists mentioned, they are two separate things. And Dr. Williams asked a very, very important question, and the answer to that question is yes. Now, we need to understand that depression, as one of the mood disorders, it can easily go into remission, easily. So as our panelists mentioned, a lot of times it takes up to 2 weeks for us to be able to recognize whether or not it's a prolonged thing. But I do need you to understand that it can go into remission. However, it is not something that people can just get over. So that is important.
Very much.
Can I add to that?
Yes, you can.
So somebody who is considered to be mentally unwell can still function. There are people who have diagnosis like schizophrenia, depression, and they're able to function in society. There will be periods in their lives where they need to take a break to attend to the mental health. And once they take a break to attend to the mental health, then they are able to resume life. And the thing is now, and that is part of the stigma. And a lot of people are afraid when it comes to mental health. And an example that I have, I remember working with a family, and the parents basically said, you know what? Mental illness is not invited in my home. There's no space in my home for mental illness. And that takes me to that place where you have to talk about the stigma. Because if you hold that mentality that mental illness is so bad, and people think that it will completely derail a young person's life, it may cause certain delays, but at the end of the day, a person can still function, have family, own a home, have a career, and still function despite the impairment in their day-to-day,
Life.
in their mood, actually.
Beautiful, beautiful. This brings me to another question. And I'm going to be asking the panel to take a minute and give me an answer to this particular question, every single person. What advice would you give to a family who has a person in that family showing signs of mental illness?
Well, first of all, the family have to understand what mental illness is all about, because the family can be a source of stigma as well. Not understanding can basically cause the person to feel like they are an outcast in the family, that they don't have a voice. So in order for the family to support that young person, the family also have to know that as much as they are part of the family and they want to help, not all help is helpful. And they can be a hindrance or a barrier to that young person's seeking support.
Thank you very much. Yes, sir.
It's a very tough question because, like the panel said, it's not something that's easily discussed within a community. So I guess the first part is to open up that door of communication, let the individual know that, you know, it's okay first, and then at that point, like you said, see how prevalent it is, because I think what's been said by everybody, it takes about 2 weeks for it to be a prevalent thing. So make sure it's prevalent, and then at that point, maybe help them to seek help.
Thank you very much. Yes, ma'am.
Absolutely. I agree with everything that they said. And like I said before, normalize these conversations, talk about it, share your knowledge with that family member, educate yourself and those in your community. If we do not normalize these conversations, if we do not talk about it, if we do not have these dialogue, then it's just going to go swept under the rug as it has been in the past. Share statistics that you've seen. And like I mentioned before, 1 in 5 Canadians. So we all know someone.
Thank you very much.
Well, the family involved in this matter needs education. So knowledge is power, because well-meaning people may mislead or ignorantly misadvise because they lack knowledge, so sort of ignorance. So we need to talk about this so that people will understand that this is real. It is a serious issue that needs to be understood so that one that is involved can seek the real help they desire. Thank you
very much. Yes, ma'am.
Okay, one must, very good question. One must realize that as a family, coping strategies can be taught, can be learned, and it includes how they request information, access resources, and obtain support. So all of those variables must be on hand to assist the family and the individual with a mental issue.
Thank you very much. Wonderful. There's a question that I want to address. And the question comes in, and it says, where in the Bible can we find a place where somebody wanted to end their life and God redirected forgiveness, redirected for greatness? How does going through trials like these get addressed by the church? And I think I want to keep that one. Because one of the places that we would find in the Bible is what happened to David. David had every single reason, and he did. He stopped eating, he stopped caring, and he was depressed. There was obviously a mental illness going on. And he locked away himself, and one would think, okay, let's leave him there. But he had to deal with the issue that he knew he was a part of. So sometimes the truth is that sometimes, and God redirected him, by the way, to become an amazing king, and from his lineage came Christ himself. So we want to look at this from the prospect where there is no ending, there is nothing wrong with someone being mentally challenged to the place where people put them aside. What is wrong is that people who have the knowledge kick them aside. Because a lot of times people don't directly kick them aside because they have the knowledge. They don't know how to help. They themselves are suffering from the lack of knowledge. And this is what the Bible says, for the lack of knowledge, my people perish. And so it is the church's responsibility, I do believe, that when we get the chance, we should make sure that we anchor people in truth and love. Allow people to see that no matter what your situation is, you're respected. You're not an outcast. Because the truth is, the person beside you might be suffering from the same problem. The problem is that yours is known and the person is not known. And sometimes if we take a good look at ourselves, we would have realized that we can do much more than what we're doing. And so I hope that out of this huge discussion will come the kind of greatness that we're looking for in helping people. Another question, how do you not feel bad for struggling with things such as anxiety and fear, suicidal thoughts, anger, and depression when it is deemed as a sin to some, specifically in the church? I'm not sure how this is viewed by this person, but anger and depression and all of this come as an influence of a spirit. And so I would want to answer whomever that question comes from, first of all, by saying, if it is deemed as you might have thought to be a sin, then all of us have sinned and come short of the glory of God. So you will have to look at how you evaluate yourself when you do think that you've sinned. And one of the things I want to remind people, and I am a living witness, it's not easy to get out of a situation that you have put yourself in mentally. It's one of the hardest things. When you can get up from an act that you've committed and others sympathize, when you have put yourself there. And that's why the Bible says, if you condemn yourself, God is greater than that. And so you have to understand, bring into the equation somebody of a real godly, loving character, somebody who really cares to reassure. And mind you, what I've found over the years is that a lot of time people would prefer to linger a little longer in sin. And I have to be honest. And we don't want to confuse sin with mental illness, because then all of us are suffering from mental illness, because we all have sinned. And so a real Bible-believing church would be at a great advantage by dispersing love. That's going to be the underscoring of the situation. Dispersing real love for a godly change.
Can I add something here?
Yes.
Because when it comes to mental illness and mental health condition, research has shown that spirituality reduces the rate of depression and anxiety. Because again, it helps people to understand their identity. It helps improve self-esteem. And self-esteem is basically a precursor to having good mental health.
Very good, very good. Another question is, how can someone who is deemed to have a mental problem be subjected to any kind of help when the surrounding has deemed them crazy?
I'm just going to add to what Sister Fiona just said because it's just such a powerful thing. As a church community, people come here for a sense of belonging, for a sense of feeling like they are a part of something. And so, like Dr. Williams says, love. But coupled with that, I want families and friends to understand that it is intentional care, intentional effort, consistent effort and care that will help people that are going through that.
Thank you very much. As children of God, at what point do we identify what is physical from what is spiritual?
Oh, well,
I'm going to throw this to the panel before I kind of give you the general answer to it. At what point?
well, when I say my feeling on that, we might disagree. We might disagree with Sister Fiona.
And that's all right. We have
Because for me, it's the spiritual that controls the physical. So when something becomes consistently bad looking, it is a problem. But how do we approach this individual with such consistent negative appearance? It's the way we approach them. We make them want to get help from us. So we first of all have to identify that this individual needs help. So we don't stereotype them. We don't isolate them. We need to bring them in. But how do we bring them in? If you are wearing a sad face all the time, I will not come to you if I have a problem because I don't know how you're going to take me. So we need to be in love. We need to be in the house where one pray for one another because we are one body in Christ Jesus. We need to understand that no one is above mental health. It can be to any one of us. You know, even Elijah in 1 King had suffered some kind of depression to the point of wanting to die.
Yes, he was chased by Jezebel and thought that he could not have endured that no more. But the interesting point about that particular incident is he had just won a huge battle. He had just came out of a victorious situation, which, by the way, embraces a lot of what's happening. You can be very strong at one point, and at the other point, you are so weak that you want to end your life.
Yeah.
And I'm not sure for a second because I want the general public to understand. I think there might be people who want to ask myself, where was it that you're not online with or educated? I don't know if I get it as yet. However, this is something I want to throw out there. Something that is physical, I want this to be understood. Nothing that is happening physically negative or even positive that has not begun spiritually. And so to say, when do we differentiate it spiritually from a physical issue? I'm not thinking it's really a statement that is accurate because it does, all physical happening has a spiritual connection. It is so then that it is what is born out of the spirit that you see. For example, somebody who rapes, it's not an act that just gets up overnight and just happens. This happens in the spirit, endorsed in the spirit, accepted in the spirit. Some of the time, most of the times, the victim is identified long before the physical happening is done. One don't get up in the middle of the night and say, I'm going over to Sister Fiona's house and we're going to have sex. It has to be premeditated and consented by both, or else that's a rape. So if it's not a rape, then it has been done a long time. Somebody come and saw what's happening. The act is seen, but that's physical. It began way back. And so we got to be careful how we look at these questions and make sure what you endorse in the spirit has the potential to be borne out physically. And this is why prayer and fasting becomes so important, very important. I know we're out of time, ladies and gentlemen, but I just want to throw last coin in and deal with trauma. Trauma. I've seen it. I've been there. I have had loss that traumatized me to the point where I was standing in the worst kind of snow. Some of you might have been there. And I did not realize I was freezing to death. I was so traumatized. My question to the panel this evening: what would be your first advice to someone who has undergone real trauma? And I know these nurses, you've seen it all the time. What would you advise someone who's gone through real trauma and decides not to go to the hospital? What would you advise?
Well, first, thank you for that question. First, one must recognize what trauma does to an individual. Some of the earlier symptoms, the person may be in a numb state, depressed, continuous depression without period of calm or rest, and the person may decide, I cannot go, to get help. So there are two emotional extremes there. Either the person may be overwhelmed or feeling too little, numbness. So it would take somebody who really understand how to use various coping strategies to get that individual to get to the point where they're comfortable in seeking for help. So various coping strategies that can assist that person to allow the person to know that there's something positive about seeking help outside of themselves, outside of the family, and we must have that respect for the individual too in not going forward in seeking assistance. If they're able to internalize and to apply various coping strategies themselves, that is also should be encouraged, because their independence in dealing with the issue and getting through it, maybe they just want to do it on their own. If it's to the point where there's some dysfunction or there may be threats of self-harm or suicidal ideation, then for sure that person needs outside intervention, and the family or supportive others would have to act on that person's behalf in getting help for that individual.
Thank you very much.
Awesome.
All right, Sister Digi, go ahead.
A person that had been traumatized and refused to seek help, obviously that's a dilemma, a serious dilemma. What I would be doing is to introduce other sorts of help. Probably my tone, probably my presence was not able to do it, is by bringing other team members in to assess the individual. Probably it will buy the idea of the other person that just appeared to them other than me.
Beautiful. Yes, ma'am.
Wonderful. Thank you. So when I think about trauma, I think about a lasting emotional response, and that happens by going through a series of events. So it's not necessarily something that happens today right on the spot, but if it happens right today on the spot and that person is in physical distress, I love what Sister Digi says, we sometimes call it second voice. That means we get someone else because perhaps your approach or your tone was not enough to get them in. And as a mental health first aider, I've seen firsthand of persons in physical distress, and everyone around them is looking and wondering what's going on. And they are going through an episode, but it's not identified because, again, we're not educated on the topic of mental illness. And like Sister Digi has mentioned, once that second voice comes, usually the second or third voice, that person will yield and they will go into the trauma center or the hospital where they can get the appropriate medical attention.
Thank you very much. I'm going to ask Brother Digi to give us his opinion on that, and then we're going to ask our educator to kind of level off the topic.
Okay, thank you. I don't have a lot of experience with medical trauma or psychological trauma, but I would think, as a layman, that first is try to understand, treat the person with understanding, but also know that it may be above you. Like if I was to have that experience, I would not know how to deal with it. So I would just get them to someone who is experienced in that field, that has the knowledge to properly deal with it. Because it is something, trauma is very serious and very impacting to the person experiencing it.
Thank you very much.
So when it comes to trauma, traumatic events, whether it's rape, whether it's war, violence, they do create trauma, which is like an emotional injury. And people have developed maladaptive ways of coping with trauma, and some search for ways to cope effectively with the consequences of the trauma. And when somebody is traumatized, one of the things that is compromised is their sense of safety. So ensuring that they are safe, whether it's in a counseling room or within the environment that they live in, their safety is always the most important. And that can be built, like when people are seeking service, they may not seek service because they don't feel safe. And even safety in the sense of cultural appropriate services. So if there is any mistrust regarding the services that you are about to receive, people will be less inclined to seek those services. So when it comes to trauma, there is a lot of agencies that offer trauma-informed care that helps the person process. Because when you are traumatized, you have to process the trauma over a period of time. Because it could be like a scent, a smell, a sight. Your senses become so activated, and a color can remind you of your trauma, the flashback. So people sometimes walk around being very hyper vigilant. And that sense, because the sense of safety is compromised, and they want to be able to feel safe, to be able to live in an environment where they are safe. So trauma is a very big topic. And as we know right now, with everything that is going on, there is a lot of trauma. However, trauma could happen at a very in an interactive relationship. For example, a child come home and show the parents a report card, and the child probably get like a 50%. And the parents is like, the respond out of anger, out of frustration, really berate that child. So every time the child go to seek exam, the child will be traumatized because again, may remember what the parents say.
The fear of getting another 50.
Yeah, pardon me?
Fear of getting another 50.
Exactly. And that might traumatize the child where the child may not perform and may be afraid to come home because it reminds them of that trauma.
Thank you very much. There you have it, ladies and gentlemen, mental health and well-being awareness. I assure you that this is part one. Put your hands together, ladies and gentlemen. You did very, very, very well. We have raised the awareness, and our goal is to make a wall so that no one is locked in. So we thank you very much, and we're going to be looking forward for part two very, very soon, where we dig deeper into some of these problems that faces us as a people without resolving. We have seen people, and in this particular time coming out of COVID, pre-COVID, a lot of people thought they were mentally well. And then COVID hit, and post-COVID, we are seeing now a lot of traumatized people. And so it is necessary to have these kind of talks. I'm truly happy to have you with us this evening, ladies and gentlemen. Let me just thank Brother Digi. Put your hands together for him. Our educator, Sister Fiona, put your hands together for her. We have our mental awareness personal, Sister Rodell. Put your hands together for her. We have our excited medics with us in the house this evening, Sister Digi and Sister Jackie. Put your hands together for them. Ladies and gentlemen, we thank you very much. You have done an awesome job. We have begun to raise the kind of awareness that we need in our culture, in our community. And so we're going to ask you to make sure that you take this as a grander opportunity to make sure that you build this wall however you can. I personally will make sure that there is a third and a fourth and probably a fifth where we can have people, the general public, coming in to raise their questions and have their questions being answered. It is something that is long waited for, and we have gotten to that point. Thank you very much. I am your host tonight, Pastor Williams, and we will definitely have other sessions. Thank you very much, ladies and gentlemen. At this point, those who are on air, we're going to ask everybody to bow your heads as we pray and close. Father, we thank you. We thank you that we did not take this lightly, but we understood what it necessitates. And so, God, as we come into your presence this afternoon, we came with a open heart. We came with a mindset to receive. We came with questions to be answered. We came with the love that perfects the human heart through your spirit and cause us to be able to deal with situations such as mental illness and mental health, bringing to the forefront, God Almighty, those who have been cast aside and put down, for them to understand that when you came, Jesus Christ of Nazareth, it was not for the well or the well-being, it was for all. And so tonight we give you thanks, Lord, for having us here. And we pray that as we share one with the other, we will go out as good stewards, ready to help those who are weak and vulnerable, those who feel as though they're not worth anything, my God. And for that, we give you the glory, the praise, and the honor. In your precious name, Jesus Christ of Nazareth, we pray. Amen and amen.